everybody. Welcome to the Healing Arts Podcast, where I get to talk with healthcare practitioners from a wide variety of different disciplines so we can expand our conception of what's possible within this healing arts world. Today I got to talk with Ryan Shroyer. He's a very smart and very, very skilled body worker. He's a massage therapist plus, because he has done tons of studies outside of the massage therapy program that he was involved with at the Colorado Institute of Massage Therapy. So we talked about that. We talked about some of the things that he has learned outside of the school and also a deep dive of what he learned within school so that we can all kind of get an idea of what a massage therapy program is like, particularly the one that he went to, which is a little bit different than the traditional sort of school. So we talked about all of that. We also talked about a little bit of a deep dive on what happens when we put our hands on people in a therapeutic environment. This is a question that has really obsessed me for quite a long time now, and so we got a little taste of maybe what some ideas of that are. And so I love this conversation. It was a fascinating ride, so come along for it and hope you enjoy. Thank you very much. Thank you so much for talking with me today.
Madam, I'm happy to be here, man.
I'm happy for you to be here.
From one friend, from one practitioner to another, dude. Thanks for having me.
Definitely. Thank you for being here. I've so much enjoyed the work that we've been trading. For all of our listeners, we've been trading work for a long time. We've been friends for a long time. Teaching at the massage therapy school for some time. You longer than me, I'm sure. But in any case, it's super exciting to be able to talk to you today. So maybe my first question can be, how did you get into this world? How did you get into massage therapy and body work in general?
Yeah, well, right after high school, I thought I was actually going to pursue something in biochemistry because that's what I really enjoyed back in that time. So I studied either toxicology or pharmacology, and so I chose pharmacy because that's what makes the big bucks, right? To be a legal drug dealer. I was like, sure, I'll give it a try.
Nice.
And so I go to Wyoming, about to go to pharmacy school, University of Wyoming, Laramie. And then I actually had a psychedelic journey. And I was basically guided to say, hey, pharmacy school's not your calling, man. We need to take a different route. And so basically, the universe, God, however you define the higher intelligence, guided me to University of Colorado Springs, where I graduated with a Bachelor in Health Science, just something to set a foundation for me as I pursue something in the holistic realm. And, there's lots of holistic modalities, right? So you got your massage, your acupuncture, it could be a DO if I wanted to go the doctor route, chiropractor. It's like, how do I decide which one? And really, at the end of the day, I was interested in a lot of modalities. And so what I really wanted was just what's the best and most efficient and quickest way to have a hands-on practice and have a license to touch. And massage therapy ended up being that. We have a couple here in Colorado Springs as far as schools go, and Colorado Institute of Massage Therapy is really the best one here we have in Colorado Springs, so I chose that one. And I graduated. It's a year program, so I graduated, got Neuromuscular certification, and then from there, that's where I started all my certifications and journeys. So, I went to Reiki, got a Reiki Master certificate. I went to Thai massage with Leah, and I did craniosacral therapy with Upledger Institute. Visceral manipulation with Baral, hot stone therapy. I mean, all sorts of different things that I offer now. So now that I have that license to touch, that kind of set the framework for where I am today.
Right on.
Yeah.
So not going to pharmacy school was the right call.
It was an excellent. I never look back.
Right on. And it's interesting because I'm sure, I know for a fact, because I work with these people, who are helped by pharmaceuticals.
Totally.
It's possible,
Yeah.
And yet, maybe there are some ways that modality could be used, I don't know, better. But in any case, I'm happy that you went the route that you went because I think that you're a fantastic practitioner. And all of the people who you work on, I definitely are grateful too. So I'm curious about this psychedelic experience because this is actually the first time I'm hearing about this.
Oh, yeah.
So I don't know, maybe if you could give, sometimes it's very difficult to describe these things, but
Yeah.
maybe if you could give us just a little more about that. Can you unpack that a little more? What happened in this experience?
Okay,
That
I'll
kind
tell
of
you.
led you in this direction.
Totally. Without getting too esoteric and in the weeds and kind of getting to the point, basically kind of what it was next to Laramie is a park called Beatavoo Park. And it's known for hiking, rock climbing, all sorts of other things. And basically that's where we had a mushroom trip. So me and some friends went out. It was a pretty beautiful day. And I just remember during the trip, there was just an inner knowing. And like you said, Bob, you can't really describe it. It just hits you. You're just like, okay, this is interesting. I'm getting images and inner knowings, and all these things are a guidance trying to disseminate information to me that pharmacy doesn't feel right. Logically, I thought this was the right call. I'm good at this, therefore this could be a good career. But when I actually dove into my heart and listened to my inner intelligence and what that resonated with, and on my soul's journey, my soul's path, you could say, that's when I really, when I tuned in, mushrooms just helped me tune into my heart. Basically, I was guided and said, hey, I think there's a different path for you. I think you're, I didn't know what it was at the time of the experience, what that was. It's not like it just told me, go to Colorado, go to UCCS, get a bachelor. It wasn't like that direct. It was just a guidance, just saying, hey, your soul's journey is going to take you somewhere else. And so I just kind of followed that, and everything just happened naturally. All the tiles along the path were just laid down one step at a time. The semester ended. Things didn't go well with some of the roommates that I was with. I didn't really like Wyoming. I want to go back to Colorado. Parents said they would support me through school. All these things kind of lined up to where it was like, oh, wow, okay, I kind of see the path now. I need to just come back to Colorado, take my parents up on their on their offer that I was very grateful for, to host me while I was in college and take care of me and to get my bachelor's, and until I was ready to leave the nest. But yeah, that's kind of how my journey ended up here.
That's awesome. And was that like a surprise 180 flip? Or did you kind of have the feeling that maybe pharmacy wasn't right on some level before that?
Yeah. It was a gradual understanding. Do you mean how did I go from pharmacy to here? Was it gradual, or was it?
Yeah, like before this psychedelic experience.
Yeah.
Did you kind of have an inkling that maybe it wasn't quite right, or were you like, no, this is what I'm going to do, and then all of a sudden after that day you were like, boom.
In hindsight, I think at the state of mind I was at, I was so naive that there were lots of clues. In hindsight, if I was at a higher intelligence, emotional intelligence, just overall intelligence, I might have picked up on those clues. But at that state of mind that I was at that time, I didn't pick up on it. So if you asked the Ryan back then, I would have been like, oh, I'm just going to blindly follow this path that I think is right. Now the current Ryan's like, oh man, in hindsight, why do I even think about pharmacy school? So there were clues the people there weren't my people. The college wasn't my type of college. And I actually didn't do well in school. As far as that college went, when I went to UCCS, I actually ended up with cum laude. I got 3.6, and I was really happy about that. When I was in Wyoming, I was not into it. I was not doing too great in my classes. I didn't care too much. But then when I went to UCCS and I saw this path very clearly, and I was learning things that I actually wanted to learn that interested me, it was like, oh, I'm interested. I'm engaged. I'm learning better. I love my professors. I'm very blessed where I'm at. And so that's kind of how it went.
Beautiful.
Yeah.
Beautiful. Yeah. Beautiful. Okay. And what, as you were looking around for schools in Colorado, massage therapy schools, you said CIMT is the best one. That makes me very happy to hear you say that. I haven't done that research myself. The universe the universe led you, the universe led me into CIMT as well, and I didn't, because I'm not a massage therapist and I never was a student of massage therapy, I didn't do any of that research, but I guess my question here is what kind of research did you do and how did you conclude that the Colorado Institute of Massage Therapy was the best one?
Okay. Yeah, basically the way it went down was, I'm trying to remember if this was during my foot. Yeah, okay, so I had a foot injury. Don't need to get into the details there. Basically, I had a foot injury. It was a Lisp frank ligament injury on my right foot. Tore it, so I was in a cast, boot for 3 months, recovering at my parents' house, and this was literally right after I graduated college. Yay, bachelor's! Oh, ow, I'm kind of out of commission right now. And so this kind of gave me time to really dive in and think about what it is that I wanted to do. And my parents were actually good mentors on this, even though they didn't really have a health background with what they do. My mom really taught me a lot about how to do good research and find out where it is that I should go and look at this properly. Because my initial thought was I thought I was going to be in this little tiny massage school off Powers Boulevard east of here. And I was like, oh, this is the one. I'm sure this is it. And then my mom's like, let's dig a little further. And sure enough, this guy actually graduated from CIMT and made his own massage school. And she's like, okay, well, he's learning from this school. This school actually has a neuromuscular certification program. He can't offer that because it's actually an international program, right? International Academy for Neuromuscular Therapies. And so we actually are accredited to teach that program at CIMT. He is not. My mom's like, he's like, well, Ryan, do the research. This is actually a better option. You pay a little bit more, but you are getting way more out of it. And so I'm grateful that she guided me out of my naiveness to thinking he was the right one, but actually it was clear as day. CIMT was the best one now. There's some in Denver that look really good. Denver Institute of Chinese Medicine. There was an Institute for Traditional Chinese Medicine in Denver. And then there were a couple other massage schools in Denver, but I didn't want to commute. So those were out of the question for me. So, yeah, I ended up with CIMT there.
Cool. Nice.
Yeah.
Nice. Yeah, I think CIMT has got a pretty great program, and especially the cadaver lab, of course. You know how biased I am towards that.
Yes.
For people watching and listening who don't know, this massage therapy school actually has a cadaver laboratory attached. It's within the same building, but separated spaces, but it's within the same building. And so the students can literally walk out the front door, go around the back, and then enter into this beautiful space where we learn just an incredible quality and quantity of information.
Yeah.
And to have that at a place where people learn hands-on body work, it's unbelievable. I really, it blows my mind, especially because so many, even universities, are getting rid of their cadaver programs. My chiropractic school was one of those, and that's, the main reason why I was even there to begin with, at that laboratory, because I was seeking an experience, like this. And so, and this Institute for Anatomical Research is the place that opened that up for me. So, what my chiropractic school didn't offer, this place does offer, and it's just incredible. So maybe we could talk about that a little bit more. But first, I want to ask about what you learned in CIMT. You mentioned the neuromuscular certification that's in conjunction with a traditional massage therapy education.
Yep.
So maybe can you give us the long version, What does a traditional massage therapy program look like? What kind of stuff do you learn in there? And then what kind of stuff do you learn in the neuromuscular track?
Yeah, totally.
So those are two huge questions, and give it to us.
Yeah, definitely. I'll do the best I can. So basically, we're divided into 2 separate classes. So we teach PM and AM classes. So Tuesdays and Thursdays, we have PM and AM classes. So we see students 2 days a week. And they switch. So one day they're in technique, and then that means the next day they're in theory. So they switch off. And so a total of 4 classes, but that's actually going to be changing soon. Apparently, it might just be 3 classes starting next year. But this is the way the way it is now currently.
You have technique side, and then you have theory side.
Technique and theory side, and I teach both, so I'm somewhat familiar with both. But basically, you have your technique side, so that's your Swedish. You start out with your basic strokes, your effleurage, your petrissage, your gentle joint movement patterns, and how to be flowy and connected, and just how to give an overall welcoming, warming massage. If you work at a spa, most of them are Swedish. So this sets your foundation, your foundational techniques, so that you have a stepping stone for the other technique programs, or the other technique classes that we learn later on. So yeah, basically when you test that as Swedish, you're then going into KOB, so Kinesiology Overview is the acronym for that. And so what that is learning all the muscles. So we learn how to palpate the muscles, where their attachments are, and then we teach something called the wheel jammer protocol. So using that protocol, it's the most thorough way to treat a muscle. And that's we basically teach how to treat every muscle in the body using that protocol. And it's, I think we counted 140 something muscles that we learned in total within, is it almost 14 weeks? I think. Do you teach the theory side?
I do teach the KOB class.
It's like 14 weeks-ish?
That sounds right. I think it is a 14-week class.
Sounds about right, yeah. So in 14 weeks, they're learning that many muscles, right? So they do the core first, the core muscles, then they go into the extremities, and
facial muscles,
the TMJ muscles, everything.
Yep.
So that's what's really cool about this school in that aspect is not all massage schools will teach the attachments of every muscle in the body, and they're not that thorough about it. For example, TMJ muscles, they don't always learn how to treat the lateral pterygoid. That's I don't hear that too much, and so that sets us apart from other schools doing that type of work, and then also rectus abdominis going to the pubic bone. Some spas or even some massage places will not allow that type of work. They won't allow glute work or abdominal work or any type of invasive work like TMJ because they're just trying to play it safe and they don't want any liability. So I understand that part, but for those who are looking for medical massage and are looking to try and become more whole and heal what it is that they want to get healed, then you need to be more thorough and you need to understand your anatomy at a deeper level and know your attachments.
Totally. Yeah, relaxation versus therapeutic style, right?
Yeah.
Nothing wrong with the relaxation style. Sometimes people want that, but you and me that's not what we do. We do therapeutic body work.
That's right.
We're trying to get people actually well. So
that's right.
So at the beginning, you learn maybe the relaxation sort of style as a foundation.
Yep.
Learning how to touch in general.
Yep.
And then you get more anatomy detail. You get more so that you can get after that therapeutic.
There
Okay.
you go.
All
Yeah,
right, cool.
all the foundations, right?
Okay.
And so, how to time your massages, what's your proper strokes, how to do a health intake, ethics, which is all covered on the theory side, and a little bit in the technique side. We kind of try to overlap a lot of what we're learning from technique and theory so that it sticks better, right? Repetition means you learn it better.
Mm-hmm.
So we do try to, for example, in neuromuscular physiology, at the same time they're taking the joints and muscle energy techniques class. So how do we incorporate isometrics and other types of METs in with what they're learning on the theory side? And what's the theory behind why muscle energy techniques work?
I don't know this muscle energy technique.
Okay, so after KOVs, you learn the muscles, you go into joints and muscle energy techniques class. So this class focuses on joint mobility, so how to move every joint, what are some of the different movements and techniques you can do to mobilize every joint in the body from core to extremities. So we call those BMTs, so body mobilization techniques. And then we get into muscle energy techniques. So with muscle energy techniques, the client is engaged now. So it's not just me passively moving the body. So now we're getting into, okay, I'm going to have you do an isometric. I'm going to have you hold this for 10 seconds. If it was like I'm working a medial rotator muscle, such as the teres major, I'm going to have you resist medial rotation, 10 seconds, 10% of your effort, 10 seconds is up. Now I can go into a basic isometric stretch. So now I'm going to stretch it this way, hold the stretch for 10 seconds, and lateral rotation, because that's the stretch for the medial rotators, like teres major. And then I repeat, isometric, stretch, isometric, stretch. We do that 3 times.
You call this muscle energy technique.
That is one example of the muscle energy technique. So basic isometric, we used to teach painful arc. So imagine someone is moving into flexion and they're like, ooh, it hurts there, it hurts there, it hurts there. Oh, it's not too bad right there though. There's an arc within their range of motion where there's pain. It's not the entire range of motion, it's just this small portion. And so basically there's a technique for that. So it's an isometric technique, but I'm just doing the isometric within different points of where that range of motion hurts. And then I recheck. We always recheck after we do these techniques so that we know that what we're doing is working. And it gives the client confidence that what we're doing is working. It gives us confidence. And so, that's another one, painful arc. Another one that's really interesting and always gets me, and we call these subtle techniques. But you might have heard of strain counter-strain.
I kind of want to say that rings a bell, but maybe not. Tell me about it.
Totally. So this is an osteopathic technique, actually. A DO invented this technique, and Dr. Jones, from the Jones Institute. So Dr. Jones, he made his own institute, the Jones Institute. So Jones Institute is the ones that primarily have disseminated this information that Dr. Jones made. So this technique is based on the principle. I like it because it's subtle and it's very minimally invasive, and it's less work for us as the practitioner. So what you can think about is, imagine I have like a point on the upper trap. It hurts right there. I feel it radiating. It's some type of trigger point. So you could put your fingers in there and kind of feel it melt as it goes away, and eventually the pain goes away. That's one way to take care of a trigger point. Sometimes that doesn't always work though, and sometimes it just aggravates the tissue. And it's like, dude, that hurts, get off me. It's very inflamed, it doesn't want your pressure. So we have a secondary technique that we could use. One of those is strain counter-strain, and what you do is you find that point first, and then you say, okay, what I'm going to do to your client, you tell them, I'm going to shorten this muscle, and you're going to tell me when the pain goes away. Right there. Oh, okay. So I'm going to hold your head in this position. We're going to hold for 90 seconds. I'm going to let my pressure off, and we're going to wait. 90 seconds is up. During that 90-second period as the practitioner, you can actually feel some really cool things happening. So it's just gently putting your hand right where the point is, you'll feel some fluid moving. So one of the things that Dr. Jones taught, is that allowing the body to go in a place of less tension, a place of relaxation, he called this the mobile point. The mobile point is the point where it doesn't hurt anymore, and it's the optimal point from which the body can go back into a state of healing itself. So we're holding that, and what you'll feel is these pulses. And maybe one pulse comes, and then you'll feel the tension go. And it's like this big gradual thing of just fluid moving, tissue relaxing, more softening, fluid moving, and you're just, the idea is that inflammatory proteins that have been building up around the site and have been really pissing off that area are now starting to be drained by the lymphatic system. So this gives the body a chance to drain those proteins out, release the tension, the body, and then we can get into like the GTO and MS, right? So the Golgi tendon organ, muscle spindle. Golgi tendon organ says tendon, the way I remember it is tendon is tension, spindle is stretch. So the Golgi tendon organ is responsible for if there's too much tension on your muscle, then it's going to relax it. Muscle spindle says if you put that client in a stretch too fast, it will kick you off. It says, heck no, dude. You didn't warm me up. You didn't do it gently. I'm going to engage that muscle to protect. Both of these are protective mechanisms for our body. Right? And then GTO, an example would be, well, if I take I'm the kind of guy that likes to get all the groceries all at once out of my car. I don't like to make multiple trips. I'm getting all of them, putting them into bags, throwing them in my arms, and I'm taking them inside. And then you realize, oh, so heavy. Your muscle's like, dude, you better drop it before you tear a muscle.
Yep.
Right?
Yep.
So both are protective mechanisms. One protects you from overstretching, one protects you from tearing from too much tension, right? And so for the massage therapist, we want to have a relaxation response, which means we want the GTO to be activated. We don't want to activate the muscle spindle and get their protective mechanisms engaged and the muscle starting to tense up. So we're trying to activate the GTO so it relaxes. And this is a point where we do that strain counter strain where the GTO says, I can let go. It's in a place of no tension, and we reset the central nervous system. So now that I'm holding it there, the body says, okay, this is a new place that I can find relaxation in. And then it lets go. You bring the head back to neutral in 90 seconds. Go back to the point. How does that feel, client? Are you sure that's the spot? Yeah, that's the spot. I don't feel it. Woo! And the students always look at me like I'm crazy because it sounds too good to be true. What do you mean I just put them in this position and then I hold 90 seconds and then bring it back and it's all gone? But it's true. And it works almost every time. If there are those stubborn places where a massage just doesn't cut it, I am almost always using that technique. And so they call it a subtle technique, but I really call it a magic technique. There is just something magical and so minimally invasive and just amazing about that technique. So,
That's awesome. That's awesome.
Yeah.
You know, and this GTO response and the spindle response and these kinds of reflexes, I'm struck right now because you'll learn about those concepts in any physiology class.
Right.
I learned about it in chiropractic school. I learned about it in undergrad, and yet I was about to say it never got applied in a way that you just described, but maybe I'd be selling it short. Maybe Dr. Linkhorn actually, shout out to Ashley Linkhorn, she's incredible. Maybe she did talk about that actually, and I do remember her talking about post-isometric relaxation.
Yes.
This is the same kind of idea.
Same thing.
Same thing.
Same
okay.
thing.
Okay. So Dr. Linkhorn would call it post-isometric relaxation. PIR.
Yep.
And then, but okay, all right, okay. So maybe I can't sell it that short. Maybe she did teach us about that stuff, but I don't know.
I love that you're challenging it.
Yeah. It's a great reminder. I love that we can bring this up. That's exactly why I want to have these conversations. You know, maybe stuff that we learned but we didn't. I don't know. Kind of. Maybe I have forgotten about it, or I don't know. It's so. This is good stuff. This is very good stuff. So this is taught in the can I call like traditional massage therapy curriculum? Would that be included in that?
Exactly.
Okay, all right.
Yep.
Okay,
Yep.
okay, all right, cool.
Yep.
Okay, and so anatomy, some phys.
Yep.
You said some ethics. I know they teach a business class or two.
Class. Yep. Bones.
It's
part of anatomy.
Anatomy.
Yep.
Yep. And let's see, what else? What other kind of stuff? And a bunch of different techniques.
Yeah.
Within this, just if you would go to any massage therapy school in the country, this is the kinds of things that you would learn. Is that right? Am I missing anything? What else? What other kind of classes would you learn in there?
Another class that we do is, so the two big theory classes towards the end of their curriculum is the trigger point class and then the postural analysis class. Postural kinesiology. Those bring up a lot of interesting points, because with trigger point, what we're doing is, okay, you learned all the muscles, you know how to treat them. Well, hopefully, right? That's 140 whatever muscles.
Hopefully.
It's like sometimes half that gets dumped because you have a lot of other crap to learn when you're in school. But you know most of the muscles and mostly how to treat them. Let's talk about deeper concepts, about these patterns that we see, why these muscles get tight, why these muscles are too loose. And then we can combine that with postural kinesiology class. Okay, postural kinesiology says like upper cross syndrome. That is such a fun topic, isn't it, Mata? Remember we talked about this in text message? I was like, I need to just have a conversation with you about this.
Fun is one word to describe it. That's a word that we could use. Sure. Yeah.
We're all taught this in school, right?
Yes.
So your head goes forward a little bit, shoulders go forward. Oh, that means that this gets really tight. And this is overstretched, and the same thing with the neck. This gets really tight, and then this gets really stretched, and this gets tight, and then this gets... So there's like these tension stretch patterns that they try to account for in a very umbrella-like fashion. They're like, all shortened muscles mean they're tight, and all over-lengthened muscles mean that they're weak. And so that's where we have these weak tight imbalances, right? And it's just so interesting to talk about this because, I think it's now pretty much disproven. I don't think it's not
simple.
It's not that simple.
Yeah.
And, it's like...
That's right.
Imagine like, I don't know, it's like I want to acknowledge some validity, but it's not completely valid. Like, what if I worked out my pecs all the time, but I didn't work out my rhomboids at all? It's like, what does that mean? Eventually, my shoulders would roll forward, or is that even necessarily true? Like, I can still.
Sure.
I feel like as long as you're using the full range of motion within that pec routine, you're training the pecs to be at a proper lengthened state within that entire range of motion that you're using it. So one could argue over-strengthening means, that means it's going to pull things forward, but then if I'm using the full length and its natural tension or natural length doesn't actually do that, then that's not really happening, right? So,
yeah, I think that this is an oversimplified, maybe, but definitely an overly mechanistic way of thinking about it.
Yes.
I'm not really a fan of being too heavy-handed with the mechanistic model. Yeah. Because there are some things that can be useful out of the mechanistic model. That's totally fine. But the problem with it, if you take it too far, is that our bodies actually are not machines.
Right.
Our bodies are organic, biological organisms, and machines are sometimes based off of that, not the other way around. It's not like our bodies are like machines. It's like machines are sometimes like our body. Yeah. There's so much that's missing in the mechanistic model, like intention and will and consciousness and the emotional world and like all of these things. You can't account for that kind of stuff in the mechanistic model. And so I think the cross syndrome theory is I have also been hearing that a couple different things about it have been disproven.
Yeah.
My friend Jules Mitchell has been talking to me about it, and I probably need to have her on here, and maybe I can pick her brain about that, and so that we can get a little more detail out of it, because those details are very fuzzy in my mind right now.
Yeah.
But in any case, one thing that I can say that's positive about mechanistic models and something like a cross syndrome theories is that they can give you a helpful place to start on how to run a session. Right? It gives you something to do. It gives you like a place to start, and it gives you a sense of direction, and that is helpful. Whether or not the theory is like 100% accurate, sometimes it doesn't matter if the theory is accurate or not, if the work works.
Yes.
Sometimes the work just works, whether or not your theory about it is 100% accurate or not. Maybe we have something like this sort of postural pattern, and you say, oh, cross syndrome, I'm gonna work this and whatever, and then by touching that human being, then they melt, and then they reset their nervous system, and they feel better. And you're like, oh, cool, the cross syndrome theory is proven correct. And it's like, well, the work worked.
Right, it worked. Right.
It worked.
Yeah.
So kind of who gives a shit if it's correct? It doesn't matter because it worked.
Yeah.
So this is a Gil Headley concept.
Yeah.
This is all Gil Headley that I'm saying right now.
Yep.
I just think it's so brilliant how he put that. The quote would be hold the good practices dearly and the stories about them lightly.
Yes.
The good practices are good and the stories about them are so yeah. Okay, so trigger point.
Yeah.
Is trigger point in a neuromuscular thing, or is that is a neuromuscular thing? Okay, so tell me about neuromuscular stuff. How is that involved in the curriculum, and what kind of stuff do you learn in that part of the program?
Yeah. So trigger point, we define it as a hyper-irritable spot when you either press on or use, and then it gets really sensitized, and then it sends a pain sensation not only where it is, but other places. So for example, if I have a upper trapezius trigger point, you can see it right there on the models of the, what's her name? The trigger point lady.
Travell? No.
Travell's, thank you.
Travell.
Yes. Travell's trigger point models. You'll see the classic trigger point of upper traps goes right above the ear, over the temporal area, comes to the head, and even sometimes to the jaw. And so that brings up the point of, and we talk about in lot, a trigger point is, client comes in with jaw pain. What are you doing? Oh, well, I'll just follow the pain. Maybe the pain will tell me exactly where it is, right? Oh, not so fast, right? And so we tell the students, let's take a step back here. We know that pain refers. Are there other compensatory mechanisms happening where the pain is coming from a different source other than where they're feeling it, right? And so this is where we try to take a totality look of the body and not just treat symptoms and treat the pain. So if, for example, it's like, okay, someone comes with a jaw pain, it's like you look at their health history, have they had car accidents, maybe a whiplash could cause the neck to get tight, and which causes the jaw to get strained, right? Or maybe they had an orthodontic issue with their whatever surgery they had in their teeth. And so it's like, okay, so maybe this is something where I should be working more directly with the muscles around that. And it's amazing, how connected that is, though. Because even a client who came in with jaw pain, the jaw work wasn't doing as what I hoped it would and what she hoped it would. So I said, let's just focus on other areas. The knee. When I released the knee and the quadriceps tendon, the jaw pain went away. And you're just like, damn. As a practitioner, you're just like, man, the body is that connected. Something all the way down from the knee is affecting the jaw. You're just like, man, you're just... And I feel like this is why our jobs are so interesting, Madhav. It never gets old. Like, there's always something so fascinating about the interconnectedness of the body and how we can address that as the practitioner. And it's like, that's where I think this is where I'll just dive into it, but like, I think craniosacral therapy, I've really informed my touch in that way. I've learned to engage the body in a more soft way, going in first, because if I use too much pressure, my ability to sense things starts to diminish underneath the skin. If I come in with light pressure, my sensitivity to what I feel beneath the skin enhances greatly. So I've learned to be more patient, and I've learned to be more soft with my touch, and to have that sensitivity, so I know I can feel the fascial patterns. And it gets so interesting, right? Because then you have someone, for example, at a C-section, and then you're just very lightly engaging the C-section, the fascia around the surgery site. And you're like, oh, you literally feel the fascial pull coming from the skin all the way to the viscera, like to a liver, for example. And you're like, wow, I feel that. So there's techniques in visceral manipulation where you can learn to engage that fascia and allow it to release at its own pace. And that's another thing craniosacral taught me, or even visceral taught me, was allow the body to unwind at its own pace. There is no reason to rush things. In fact, the body prefers you don't rush. It has its own inner physician, its own inner treatment plan. If you try to force your agenda on it and try to force it into submission and force the tissues to relax, it doesn't work out for you or the client. And this frustration starts to happen. And so it's like, well, just start slow, right? So engage the fascia, and a lot of them will say go in the direction of ease first. It's kind of the osteopathic way to do it. So direction of ease, allow wherever the tension is, allow that tissue to come together where the tension is. That softening happens. And then sometimes I can pull that to the direction of barrier and then allow that tension to... That's what they would call a direct technique. Direct technique means I am actually trying to stretch the fascia directly with my techniques, whereas indirect is, let's engage the fascia from end to end coming together, allowing it to shorten first.
This is like osteopathic concepts?
Osteopathic concepts. Craniosacral teaches it that way, visceral manipulation. These were all osteopaths that created these. Jean-Pierre Barral, and then of course Dr. Upledger. They're all great examples. Dr. Jones, who made the strain counter strain, exact same thing, right? Here's the direction of this would be if I have that point right there. The direction of barrier would be this way, but I want to go in the direction of ease. Let it soften. Let the body reset. Oh, okay, things are relaxing now. You can feel it as the practitioner. You bring it back into neutral, and you're like, where did it go? It's not there.
This makes me so happy to hear you say all of these things, because I'm reminded of one of my mentors, Arnaud Bernier. He would say the same thing. You make your contact, and you go in the direction of ease and comfort, and because there's other chiropractic techniques that say the exact opposite. You find the area of restriction and you break that restriction, and it's like, okay, I see what you're saying, like I get that idea, but I think that might be, and I'm sure that helps. I know for a fact that helps. There are people that get results with that kind of thing, and also that might be, for my taste, that might be too much in the direction of mechanistic, I'm going to make this work, this is broken and I'm going to fix it. Where, as opposed to a more vitalistic model or a more organic model would be, hey, actually, I'm not the one who's fixing you. You're the one who's fixing yourself. And all I'm doing is making contacts.
I'm facilitating.
I'm just facilitating you fixing yourself.
Exactly.
And so how are you going to fix yourself? By going into a place that's open, going into a place that's receptive, as opposed to a place that's locked down and you say, no, that's making it worse, actually. You know, no, we don't want to make it worse. We want to make it better.
That's right.
And so if you can lead people in the direction of where they're open, where they're receptive, then to me, it makes sense that they're going to fix themselves better with that approach. So I love that you're saying that these other techniques say the exact same thing. That's another reason why I'm super stoked about these conversations.
Totally, dude.
So we can see how we're actually not so different between disciplines. You know, the disciplines really, they borrow from each other.
They do.
I'm sure that the guy who I just mentioned, Dr. Bernier, I'm sure that he learned these he got this sort of influence from the osteopathic world.
Yeah.
You know, I definitely have gotten my influence from the osteopathic world. I took my craniosacral therapy training and all this kinds of stuff with Upledger.
Yeah, right.
And anyway.
Yeah.
I'm stoked to hear you say these things because they ring a bell, you know, within my own profession that I've heard. That's what I mean to say.
Yeah, and I was curious about that because I thought about it before the podcast. I was like, do chiropractors also do direction of ease techniques too? I was thinking about that because I always think of direct techniques with chiropractors, but I never think of indirect. So I was like, but sounds like you've had someone that you've mentored from who does do that. That's really interesting.
I don't think he would use that term, but he would teach it the way that you're describing it.
You know,
regardless of what kind of term you put on it. Mm-hmm. The concept itself definitely is the same. You know? So cool. It's super cool. Okay, so I would like to go more into visceral and cranial and some of these other things that you've learned.
Yeah.
But just to wrap up, just to tie a bow on this neuromuscular thing before we move on, if you don't mind. So is it okay to say that trigger point stuff is like the central tenet of neuromuscular therapy, or is there more to it than just like trigger point stuff?
Yes. I would argue that neuromuscular physiology class sets the foundation for all the other classes because it gives you an idea of how dysfunction happens in the body neuromuscularly. And so I would just like to bring up, just so our viewers are all on the same page, but sliding filament theory, right? So that's kind of the idea where we have these sarcomeres, where we have these muscle fibers, and one muscle fiber is one muscle cell, right? So your hamstring, one muscle cell goes from one attachment all the way to the other attachment, which not many people know that. That's really interesting. And it's a bunch of those muscle cells that come together to make a muscle. And so when you break one muscle cell down, you have sarcomeres. It's divided into many compartments. And so these little compartments can be broken down as one compartment end is a Z-line to Z-line. Between two Z-lines is that sarcomere. And so then you have that end line in between, and you have these filaments coming off these lines. And that's how a muscle contraction happens, is when the filament coming from the end line, which would be the myosin filament, has those myosin heads that comes up, pulls the actin filaments together and shortens the sarcomere, and that's a muscle contraction. And that's what we teach, right? So we teach sliding filament theory. And I emphasize the theory part in class.
I'm glad you do.
And it's like we always have to make sure, even in school, right? We should always question everything we learn. And I always like to have that. I want them to know what they know for the test because I want them to pass. And then you also have to say, hey, also do your due diligence and research what other information. Yes, what other info is out there, right? Listen to other doctors and other people, practitioners, see what they have to say.
Yes.
And so, one of the interesting things is this theory defines how a concentric contraction works. Concentric means I am shortening a muscle when I contract it, right? We have isometric, which is I will hold the dumbbell in one place and hold it like this while my bicep engages. At that one spot, it's not moving in length. Whereas eccentric, I'm having the dumbbell weight and my bicep contraction, but while it's contracting, I am actually lengthening the muscle. And then the theory falls apart.
Yes.
And you're like, how do the myosin heads, they can pull things together, but there's no myosin heads going the other direction to pull. It doesn't quite really fit the theory, so how do we explain it?
Yes. Yes.
And so then everybody gets confused, and it's like, well, I mean, I guess I could go backwards, but I don't think that's how it works. And so I read a research article that actually explained this, and they're trying to say titin. I don't know if you've heard of this. It's the longest protein in the body, actually. And longest or strongest? I think it was the longest protein in the body. And it will actually it's like, imagine a spring, and it goes from one line of the sarcomere to the other line, and that allows lengthening to happen, but with resistance because of this protein.
The titin is the missing link.
The titin, they think, is the missing link.
And this is called the 3-filament theory? Is that correct?
The sliding filament theory.
No, the new one, the updated one.
Oh, have you heard of it called the 3-filament?
I think what you described, I think I have heard of it as called the 3-filament theory, and we're kind of hoping that will replace the sliding filament theory as a more complete version.
Right.
And it's probably still not complete, but
totally.
It seems to be closer.
It does.
So that's cool that you've heard of it too, because
Totally.
I've heard about it from Jules Mitchell.
Yeah.
I just mentioned her a couple minutes ago, but I heard about it from her, so I'm so happy that you heard about it also.
100%.
Yeah,
I think it's really interesting. It set a good foundation, but now there's a missing link in the 3-filament theory. That might explain it, so I think that's interesting.
Yeah,
so
instead of actin and myosin, it's actin, myosin, and titin. So those are the 3 filaments.
Yeah, so I think that's interesting, and at what point do we update the curriculum, right? When do we actually set it in stone? That's always
too slowly.
I know, too slowly.
It's
how it is in all education, right? It's like, when can we for sure update the curriculum? And yes.
There's a lot of things that we could update. So
100%.
Okay,
but
so
just to kind of go off that a little bit more and piggyback it, but that's kind of where dysfunction happens and how we teach it, right? So the way we teach a trigger point is, okay, so the muscle's contracting. Why is it not uncontracting? What's happening? Well, when you dive into the sliding filament model, it says that the third ATP that is used, so the first ATP brings the myosin head to the actin, the second ATP being our energy source, second ATP is the power stroke, bringing the filaments together, third ATP lets it go, and it drops back. And so the idea is that there is no ATP being used to unwind that myosin head off the actin filament. And so that's the theory behind what we teach how trigger points form. And so something to think about, so then I continue off that in my mind. I'm like, okay, let's try to explain that further. So if why does post-isometric relaxation work, for example? Well, let's just say like I had a tight band here in my pec muscle, and we'll just say it's because the sarcomeres are stuck together and the ATP wasn't used, so we have a trigger point. So if I engage that muscle, that means the mitochondria have to start making ATP to make that contraction happen. And then when ATP floods into the cell, maybe that's the ATP it was missing to allow it to relax. That is my theory. If this theory is correct on why muscles stay hypertonic, then if I continued on that theory, maybe that's the reason why post-isometric relaxation works. Because engaging the muscle means mitochondria creates more ATP, which means the muscle can now finally relax when I stretch it. So I'm always thinking about crap like this.
I love it.
But yeah,
I love it so much.
Yeah.
Our massage therapists know their stuff. And it's not just, you rub the muscle and it feels better. It's like, shut the fuck up.
Yeah.
These people know their stuff.
Yeah.
These people know their stuff. They're good at what they do. They help people, and they're smart. They learn their stuff well.
Thank you.
So.
And then also, I just want to say that, that's not the end of the story, right? Because we have these sodium-potassium channels conducting nerve pathways, and sodium-potassium channels going across the membrane of the muscle cell, creating allowing the muscle to contract, allowing the calcium to get. So there's all these other factors where muscles can also stay hypertonic. The calcium, sodium, potassium, acetylcholine, the neurotransmitter between the neuron and the muscle cell. It's like what if that's getting over, there's too much of that inside the synaptic cleft, right? It's like, there's all these other factors, so it's hard to, the school wants to make it a blanket statement, but there's so many other things, other factors. It's like emotions. You mentioned emotions earlier, right? Yes. If I got hurt, like someone broke my heart, like I feel that right here, and you can feel the muscles contract. Yes. Is that an ATP issue? It's like, is the emotion causing ATP disruptions within maybe, but
I get this visual in my mind of a boat going through a lake, and you have the motor and the boat, and then you see this huge wake. And so you see the wake, and the wake is the biggest part, like visually the thing that takes up the most space is the wake.
Right.
So you say, oh look, the wake is the thing that's making the boat go.
Right.
It's like, no. The engine is what's making the boat go, and the engine is making a wake. So sometimes I feel that way about, these kinds of things that you're talking about, like the neurotransmitters and this kind of stuff. And I feel like maybe, this is a theory of mine, maybe some of that stuff could be a wake. That's more obvious to the eye, but that's not actually the root cause of what's happening. So I don't know about that, but it's just an idea that's been floating around in my mind for a little while. And maybe it could be something like that. And maybe the life force is the engine.
Yeah.
Maybe the life force is the engine, and then all of this chemistry stuff and all of this physiology stuff that happens is the wake of it. I don't know. But you can't get a handle on consciousness. You can't grab life force, You can't measure it with scientific instruments, and so, I don't know. Anyways.
I want to piggyback off that. I'm curious if you've ever thought about this model. I'm curious. When we think, so the energy currency of our body is ATP. ATP is produced by the mitochondria. What is it inside the ATP that gives us energy? When that phosphate comes off the ADP, it makes ADP, what is being released? There's energy. What kind of energy is that? Do you ever think about that? These are the things that keep me up at night. This is what...
That's a great question, man.
That's
a great question.
You know what it is? And this makes sense to me. It's electrons. Isn't what the phosphate... You have the adenosine with 3 phosphates. And so one of those phosphate breaks, and it releases electrons. If I'm not mistaken. These are batteries. They're storing energy for us to use in our body for the electron transport. That's why it's the electron transport chain. It makes the most energy. Electrons fuel the body's energy and its movement and its thinking and everything else. And I always think about this. I'm like, so where do electrons... So, for example, if I eat food, my body is taking the glucose, it's taking the proteins, it's taking the lipids. It might use some of that, it might store it. When it stores it or when it uses it, what is the medium? What is it that makes potential energy become kinetic energy for me to use in my body? And for me, it just seems like electrons would be that source. And so I'd love to stand corrected. If somebody has an opinion on this, I want to learn more. But from what I think it makes sense to me. And maybe people like breatharians, people who just like survive off the straight air, dude, or people who just survive off water, people who don't even eat, and they're somehow able to live for sometimes a year. And it's crazy. It's like, how are you able? First of all, you have to have a low demand for energy, I imagine, for that to even happen. You can't just run marathons without eating anything. Things like that, right? But also, it makes me just think about, like, where do we need food for energy? Now there's research showing that sunlight, our melanin is actually a place where photosynthesis happens.
I'm curious to see that research.
I would love to. Yeah.
I'm curious to see that research. Yeah, I have definitely heard that breatharianism is a thing, and I have heard that it's legit, and people really do survive off of sunlight and air.
Sunlight and air, negative ions from the sun, from the air. It's like But then that means the negative ion, whatever it is, the electron, is being used as energy. So that's the things I think about too. I'm just like, what is the fundamental energy source that we use to do everything?
Yeah. You know, I don't know that much about it.
Yeah.
And for your original question of, you know, the ATP and stuff, these are really good questions. And I don't know, I definitely don't have answers. And I haven't ever thought of that question, you know, is there something more fundamental worth of an energy source than ATP?
Right.
This is a good question.
What's the ATP storing? What is it storing?
No idea. I think that electrons could be in the right direction, and I just really have no idea. More research required.
Totally.
But it's a very interesting question you bring up. I like it.
Yeah.
And as far as the breatharianism thing, you know, always the thing that comes to mind is it's kind of a funny straw man, I guess. But no, I guess it's not really a straw man. But anyway, the question that always comes up in my mind is okay, you can do it, so what? Like, why? Like, why would you do that? You know?
Yeah.
Maybe to prove a point.
Could be.
To prove a point, that would be a good point to prove.
Yeah.
I guess that is a good enough reason on itself to, you know, to show some scientists up.
Yeah.
You know, I guess that could be a good enough reason to do that kind of thing, but also, I like food.
I know, dude!
I like food.
Part of the human experience is enjoying food, dude. It's like,
delicious.
come on. Yeah.
It's delicious. Yeah. You know, it's delicious.
Yeah.
So, one story comes to mind of we're getting a little far away, but that's okay. I'll tell this story because it's just a super fun story. And, and then maybe we can talk about cranial and visceral stuff.
Yeah.
But speaking of proving scientists wrong, I remember I took a breathwork seminar a long time ago, many years ago. It was like 4 days worth of breathwork seminar. Amazing, fascinating, unbelievable, wonderful experience. I wish that this guy still did them, but since the lockdown era, he stopped doing them then, and I don't think he started up ever since. Jeff Premack, please get them going again. I loved that seminar, Jeff. Anyway, so one guy who he teaches with, Kai, I forget his last name, he told us this story of a video that he was shown, I think in high school. I think like back in the 80s when this dude was in high school, they showed him a video in the classroom of some monks up in the Himalayas or something. And Wim Hof would probably know about this kind of stuff. This dude's a Wim Hof student also.
Love it. Yep.
But in this documentary, they showed these monks, and they'd go out into the snow, in the high mountains, out in the snow, frozen conditions, and they would dunk a blanket or a towel in ice water, bring it up, and this is frozen-ass towel, and the monks would go out into the snow naked, wrap themselves up in this frozen-ass towel, and they would do their breath work, and they would evaporate all of the water off of the towel.
So
and they had some scientists there. And the jaw was on the floor in amazement.
Yeah.
And the guy was like, this is impossible. He should be dying of hypothermia.
Right.
And he's toasty. He's toasty as whatever.
Isn't that wild?
It's unbelievable. Whether or not it's a useful skill, because when are we ever going to find ourselves naked in the snow with the wet towel, you know? But to prove the scientists wrong is a good enough reason to do that, I would say.
Love it.
You know, to just like show science up a little bit. Like,
Yeah.
believe it or not, that really happened. You know, it's a real story. So anyway,
Well, I think that's a really interesting point, just because of like, you know, life. They talk about prana, right? So when you breathe, you're breathing in prana energy, and that's life force energy. And when you do that many breaths in a row, your body starts to buzz. And you're just like, oh wow, like it's that like rush, that feeling that I'm alive, that feeling of being present in my body, and you can feel your body start to heat up. And yeah, I love Wim Hof's technique. That's what I practice. I do his breathing. I do the cold training. I do it all, and I really love, and I really do believe it. I think breath plays an important role, you know, on the treatment table in our day-to-day life.
yes.
So yeah.
Yes. I know very, very, very little about Wim Hof,
Yeah.
but I know that a lot of people really love it, and I know that you're one of those people. So
Yeah.
so go Wim Hof and go Wim Hof people. You know, the
Yeah.
technique that I was learning was something that this guy Jeff Premack, he kind of like amalgamated a bunch of different breathing techniques and kind of like made his own.
Yeah.
That's the one that I learned, and I really like that one. But
Yeah.
in any case, okay, so you did not getting back to your life. You did not stop with the massage therapy and the neuromuscular.
Right.
You kept going. You kept going. So you mentioned at the very beginning, I think you mentioned craniosacral, visceral manipulation, Thai massage. A little bit of lymphatic, a little bit kind of here and there, maybe not officially, but you learned it a little bit here and there.
Yeah, exactly.
And then, and what's some other? I know that there's more. What else?
Did you mention Reiki?
Reiki, that's
Yep,
right.
Reiki is the other
you said
one.
Reiki.
And
I feel like there's more.
As far as yoga, Reiki,
Is that it?
sacral, and so I don't put craniosacral or visceral in front of my name yet because I technically didn't get certified through the institute yet to do those. You have to like take an exam and all that stuff, and like
you've taken the courses.
I've taken all the fundamental like courses up to this point.
Yeah.
I just haven't finished the examination process
to
yet.
get the letters after.
To get the letters after my name, so I just want to respect that. Respect, you know what I mean?
Well,
It's like a respect to the university to like keep that. Yeah,
that's cool. That's
yeah.
cool. I appreciate that respect.
I
And
still
also,
practice
you
it.
took
I
the
just
courses.
I still took the courses. I practice it. I'm just not going to put it in front of my name.
Yeah. That's cool. That's cool.
Yeah.
That's cool. Okay, so tell me. Go ahead.
Would you mind if I took a bathroom break?
Yeah. Let's be. Yeah.
Perfect.
Yeah.
Perfect.
Okay, and we're back.
We're back.
All right. Okay, so I am super interested to ask you about visceral.
Yeah.
I know we could go in so many different directions because you've done so much training, and I love that you've done so much training. So, but just to start somewhere,
Yeah.
let's start with visceral.
Mm-hmm.
All of your visceral training has been with the Baral Institute. Is that correct?
That's right.
Okay, so tell me about it. You did there's visceral manipulation 1 through 4,
Yep.
and you've done all 4 of them.
Yep.
Is there anything past? Do they do stuff past 4?
Yes. There's actually a 5 and a 6.
There's a 5 and a 6.
Yeah. So 1 through 4 is actually the core organs, like all the organs and how to treat them, and then 5 and 6 actually gets a little bit more esoteric. I just haven't taken those yet.
Got it. And then also Baral offers like brain classes,
Mm-hmm.
and that's a separate outside of the 1 through 6.
Yes. I know Upledger does brain classes. It's called Brain Speaks.
Okay.
I'm not sure about Baral. Yeah.
For some reason, I'm thinking like neural manipulation. No,
Neural manipulation. Yes, that is.
That's what I'm.
That is
thinking.
Baral. Yeah.
That's what I'm thinking.
Yeah.
And you've done that one?
I haven't actually.
Okay.
Yeah.
So 1 through 4. So tell me about 1 through 4. That's the core of it anyway.
Yeah.
Tell me about 1 through 4.
Yeah. So basically they segment it so you learn certain organs in each class all the way up, and they condense them from 1 through 4. I can't remember exactly, in this class you learn particular classes, you learn these organs, but essentially you treat every organ pretty much the same. They have like the same technique, right? So there's an in-spear and an ex-spear for every organ in the body. And so there's a movement. And so, like, for example, you have the liver, which is when it goes in the in-spear, it rolls back, turns left, it goes posterior, and then when it goes ex-spear, rolls forward, leans lateral, and rotates left. There's like a...
Organ movements.
It's organ movements, yeah, and I think I had those backwards. I think in-spears... Yeah, one of the ex-spears back, in-spears forward, I believe. Yeah, and so every organ has its own range of motion.
I like that term, range of motion.
That's the kind of the best way to put it. Yeah, it has its own range of motion, its own motion patterns, you could say. And so it's its own in-spear and ex-spear. And so you learn to listen to the in-spear and ex-spear of every organ, and notice, is the in-spear and ex-spear What's their symmetry, quality, amplitude, right? The square is actually a up-ledger term that they use for craniosacral, but I kind of applied that same thing for listening to inspire and expire for organs. And so when you listen to the rhythm and the movement of these organs, square is symmetry, quality, amplitude, rate. So what's this? Are they equally symmetrical between inspire and expire, 50-50? Or is one maybe going more into expire, less into inspire? And if so, can you move the organ a little bit and feel where the restriction is? I kind of guide it and wonder, oh, yeah, I feel it. These organs are suspended by ligaments, right? So these aren't like bone ligaments like we think of holding bones and articulations together. These types of ligaments, I'm not sure, I'd love to learn the ratio between like collagen and elastin in like a ligament in the foot or like in a bone versus a ligament suspending organs. I don't think they talk too much about that, and I wish they did. Maybe Gil has an answer. I'm not sure if you do, Madhav.
They are super different.
They're very different,
They're
right?
Extremely different.
One is way more tough and fibrous, where one is more. How would you describe the quality?
Elastic, more membranous.
Membranous, yeah, exactly. It has more fluidity to it.
More fluidity.
Yeah, and so you can feel it. It's not a hard pull like very fibrous. It's just, okay, there's more resistance when I put it this way.
Yeah.
And so when you feel that pathway of resistance and you can trace it back, so that's where learning the anatomy helps. And gosh dang, there is a lot of anatomy. Oh my gosh. You not only have to learn the inspire and expire of all these organs, you also have to learn the ligaments that suspend them. So there's like a physiological motion, which is their intrinsic motion, but then there's like a motion that they move in within their range, their spatial orientation, and the ligaments that support them, and all the organs around them. And so you're listening for all those relationships and just feeling for stickiness, adhesiveness, more viscosity, less viscosity, more ease of movement, less ease of movement. And that kind of is the simplest way to put it. And so, direction of ease is kind of the best way to start, is what the osteopaths teach. So you bring it, if there's a tension going lateral, you want to bring that organ towards the lateral position and allow it to soften, see if the ligament lets go, bring it back, recheck, see if it's gotten better. Okay, it's great now. Or maybe if it's not great, I can do a more direct technique, and I can go the opposite direction of the tension and do a stretch on it and see what that does. So yeah, everybody has their favors on how they like to treat the organs, but that's the way they teach, is indirect first, then direct.
Cool.
Yeah.
Nice. That's a great overview.
Yeah.
I love that. And so what kind of stuff, now that I think about it, it might be a stupid question, because what I was going to ask is, what kind of stuff can this help with? But it's organ work, so it helps with organ stuff.
Right.
Maybe, I don't know, can you unpack that? How does helping organs help somebody? Can you unpack that for us?
Yes, I was just about to actually, before I was like, oh, I forgot. Yeah. So every organ has its purpose, right? So the liver has a bunch of enzymes, and it's helping with the filtration process of the blood. It's a lot of metabolic things, packaging lipids, things like that. And so if the liver cannot move freely within its environment, intrinsically or extrinsically, then it's not going to be able, its function diminishes too. And so to improve the function of the liver, we can help it go back into its normal mobility pattern. That's what term I was looking for, mobility versus motility. So mobility is what's its relationship in space to everything around it, whereas motility is its intrinsic motion.
Oh.
Yeah, the inspire and expire.
I see.
Yeah. And so you're listening for its intrinsic and extrinsic motion patterns. And when you treat those, if something feels stuck, and you treat that and it goes back to its normal functioning, well, I'm sorry, I should rephrase that. After you treat it and it feels better, it should go back to a more normal functioning. So everything should have its proper movement. So when its proper movement is restored, it can do its job the way it should. One of VM3 is pelvic organs, and so that one gets really interesting. Between it's interesting. Like as a guy, you think you know where your prostate is, and you're like, wow, it's like I thought it was like more like closer to my belly button when I thought it was like, oh, it's way down here towards like below the pubic symphysis. It's like those things click you don't think about in your normal, because they don't teach organ work in massage school, right? You can see it in a textbook, but until you palpate it, until you can pinpoint it with a finger, until you see it in a cadaver lab, you're kind of blind. Yes. So I think that really hit home for me was, how to find each organ in the body was really cool. How to palpate it, how to palpate the relationships around it, and the ligaments, and to see the before and after effects of organ work. And even I mentioned visceral because a profound thing happened. I had a client, and she actually had trouble getting pregnant, and we weren't sure why. But they've tried many different things, of course. Went to the fertility clinic, tried multiple times. They've tried most of the things you could to try to get fertile. And when I was doing my palpation work around that area, I noticed that there were some restrictions. I'll just call them restrictions around that area, and to feel the relationship between the ovaries and the back, and the ovaries and the uterus, and there's all these things that were connected, whether it was pathologic or whether it was there but just shouldn't have been as tight, kind of helped release those patterns. And so shortly after, I'd say it was in a month and a half, 2 months, I find out that she's pregnant. And it's hard to say, right? I'd like to think the work helped. It's hard to say, right? I got some of the credit. She credited me some of it, but it's like, I think that's really cool. If that is true, like it makes the work so rewarding. Yes. So rewarding. Like that's life changing for some people, right? Who their organs don't function properly. It's hard to be fertile. It's hard to live with normal functioning organs.
Yeah. So yeah. I mean, maybe I like the humility, and I like that you say it's hard to give yourself, credit for it, and that's fine, because I'm sure that she was trying multiple things simultaneously. Totally. And yet, it's also hard to not give you credit for it, because if the ovary is stuck to the peritoneum or something, and the fimbriae aren't really, if there's some sticky spots around that, and with a very intelligent and thoughtful and careful touch, you're able to sort of like let that be free again. I mean,
you would like to think let's just
exactly. It definitely is not going to hurt. If it's done in an intelligent way, it's definitely not going to hurt. And if there's some sticky spots in there that can be unfrozen, then of course it's going to help those organs to function better. Of course it will. That's awesome. You got. I love these kinds of stories. You got any other stories? I'd love to hear more success stories from your practice. Maybe not even necessarily just from organ work, but from anything. Like, what are just some kind of first ones that pop into mind?
Man, where to go? Let's see. I mean, a common one that I treat pretty commonly, actually. I see it a lot. I see it mostly in desk job people. But thoracic outlet syndrome, or maybe people that use their hands a lot, people who have hard labor jobs. That's all. That could be a topic of its own, just because thoracic outlet can be easily misdiagnosed, also, right? Mm. And so, like people who have like, oh, I have this shooting sensation going down my arm, but there's multiple places, multiple joints where that can impinge in the pathway, right? It can impinge at the elbow. It could be cubital tunnel. Could be carpal tunnel, where it impinges somewhere around the wrist. Well, particularly that's the median nerve. But my point still stands that, it might not necessarily come from the thoracic outlet, which is defined as the space between the first rib and the clavicle. So we define that as 3 different ways that can happen, TOS, is the pec minor syndrome. So your pec minor pulls the shoulder forward and impinges the nerve and vascular system. Or it could be scalene anterior syndrome. So the scalene, which attaches to the first rib, is pulling down and putting pressure on the nerve and the artery vein. And then we have the other one, which is acromioclavicular, so just as the shoulder going forward. But
clavicle against the first rib.
Clavicle against the first rib. Yeah, exactly. So how much space is between that clavicle and first rib, right? How much freedom is there for the vascular system and the nervous system to move within that space before it goes down the arm? Yes. From the neck. It makes the job really interesting. And all you can do is treat the entire thing and feel for all the restrictions, because it could be either of them. And so in this case, I did a whole hand to neck routine. When you get to very detailed work like that, it sometimes takes a whole 60-minute session just to do one arm.
Wow.
Yeah.
Oh, wow.
Yeah. But at the end of the day, the client leaves feeling great, and they're thankful for that very intricate, thoughtful work. Even though it wasn't like a big full body or a big something, like that's always like a talking point at the beginning of the session, right? You always have to okay, what's the most concern? The full body, that you get touched on all the parts that you want to be touched on, or address the issue. Yeah.
Yes.
And so if they're cool with it and say, let's just focus on the issue, then okay, thank you. That gives me the freedom as the practitioner to really hone in and address the entire trend in that area.
Yes.
And so I did. I've had great success rate with thoracic outlet syndrome and carpal tunnel. Those have been I treat pretty successfully.
And that can be a huge deal for people.
Oh, huge. Oh,
that can be a huge deal for people. I was just working on a flight attendant yesterday.
Yeah.
And she was like, my thoracic outlet syndrome is getting so bad that I'm dropping things.
Yeah.
And if you have a hot coffee in an airplane, you can't be dropping that hot coffee. That's not going to work. So she hasn't been able to work.
Yeah.
So to help people with these sorts of issues is a huge deal sometimes.
Yeah.
Sometimes it's just kind of a minor annoyance, but sometimes it's a huge game changer for people to have full sensation back into their hands, and for it to not be on fire 24 hours a day, and it keeps them up at night and they can't sleep, and because they can't sleep, then their partner's, upset because they're upset and everyone's upset, and it can be a huge game changer to help something like TOS. So
absolutely.
That's awesome, man.
Yeah, it's as you're saying that, it's like easy to take things like that for granted when we have them and they're always accessible to us, but then when we lose it or it's incapacitated in whatever way, it's like, oh,
yep,
I'm grateful I have this right now. It's like those things you kind of think about in the moment. You're like, oh.
Yes.
And that's what makes our work so rewarding, right? It's like to help them, because that takes a psycho-emotional component too. After many months, sometimes years of having that condition, it starts to weigh on them. And they really start to feel it on an emotional and psychological level. It's like, okay, well, sometimes that component needs to be addressed also, especially with chronic pain in general. Chronic pain tends to have that emotional component. Oh, it's just, I live with it now. I'm depressed.
This always hurts.
This always hurts.
I hate hearing that one. It's like, maybe don't use the word always.
Oh, yes! Exactly.
Maybe don't use that word. Maybe say up until now. Up until now, it's been always. I don't know, something. So that it's not, so you don't hold on to it so tight.
Right.
Like, this is always the way it is. This is always how it will be. Like, no, that's not how, you're not going to get very far like that. I get it that that's been your experience up until now. Right. Anyways.
Yeah. I think that's such an interesting topic on its own. Just, I'm a big Joe Dispenza person, so I went to one of his retreats, and it's just amazing to see when people tap into their body and come from that neutral or high vibration or standpoint of just, wow, why have I been thinking these thoughts? I need to retrain my mind in a different way and facilitate new neural pathways that resonate with healing. And so it's like when people actually have that, healing happens in sometimes seconds. I mean, the body knows no boundaries in how to heal itself, but we sometimes interfere with that ability. We get in the way of our own healing sometimes. And I think that's like, it's tough because I want to, as a practitioner, I want to help with that part of it also, the mental component. And then there's also kind of like the scope of practice part of that also. It's like, well, I'm here to do body work, and if an emotion gets released, that's great. I'm not a counselor though. I can't help them through the grief. I can't talk about what they should be doing and what shouldn't they should be doing to psychologically remediate that situation. And so that's where you can refer, right? But I think this is where, like, for example, in like craniosacral therapy, they go through like somato-emotion. CERTIP's like one of their classes, somato-emotional release, therapeutic imagery, and dialogue. And so when you take the SER classes, you start to learn like, hey, when that emotion comes up, sometimes the client is willing to talk about it, and talking about it with you being neutral as you can be as a practitioner, not coming from a fix-it mindset of, well, think this way, and maybe you shouldn't have them in your life, or maybe you should think about it. And it's like, if you just come from a place of neutrality and just say, hey, have this inner dialogue within themselves, help them facilitate that inner dialogue of talking with their subconscious mind, which has this pathway that's been sending, all these terrible signals for years and years that's been causing dysfunction, and have that subconscious conversation with their conscious mind. Like, hey, subconscious, do I need to be having this? Is this serving me right now, right? And so you can kind of facilitate that conscious and subconscious dialogue, and that's where you get into things like dialoguing. And facilitating that inner dialogue within them to allow them to get out of their own way, to allow that to soothe over. And that one always got me, because it's like, at what point do you become a counselor? I think the neutral point is the biggest thing. As long as you stay neutral and not try to like give them too much advice, then I guess we're within reason, within our scope of practice.
Yes.
So
and even a good counselor will do that also.
Mm-hmm.
Smart counselors don't really give very much advice.
Yeah, that's true.
Right?
That's
because, first of all, what do you know? And second of all, if it doesn't come from within, then it's not really going to stick very well.
Yeah.
It has to come from within for it to stick.
That's true.
So I think that whether you're a trained counselor or a body worker, either way, you have to let people fix themselves. Instead of us fixing them, we have to be facilitators of them fixing themselves. I think that's how it's done the best.
Yeah.
Regardless of what technique you're using. I don't know. Maybe surgery might be the only one where that's not the case. Maybe surgery might be, I don't know, the only thing that's popping into mind right now for me, at least. That's like the only one that doesn't follow that rule. That's the only one where you're like, but even with the surgeons though, they suture up the stuff, they tie things back together, they do their reparations, they do what they do, and then they step back, and over the next 6 months, the body heals itself.
Right.
Right? The surgeon isn't the one who's making that flesh come back together.
Right.
It's the person who's making that flesh come back together. They just do their suturing, they do their reparations, but really, it actually does hold. The person is the one who ultimately fixes themselves.
It's true.
It's the intelligence within our bodies that's really making that happen. So.
Yeah, exactly. Makes sense. All they're going to do is give them maybe some exercises or maybe some guidance on how to not make it worse during that recovery period. But at the end of the day, it's their body healing themselves.
At the end of the day, it's the body healing themselves, regardless of the technique. So
yeah, I agree.
Yeah, I love that.
Yeah.
I love that. Okay, so the infertility, you've helped with infertility stuff.
Yeah.
TOS, maybe some musculoskeletal stuff. I'm sure that's a super common thing.
I was going to say...
The neck pain, the low back pain.
Common. Low back pain and shoulder pain, neck are the most common ones, right? Torso and neck.
And what do you think your success rate is on that kind of stuff?
Very successful. I actually just got a really good review, and it made me so happy to see. And basically, I'm actually now working with workers' comp people.
Oh, cool.
So the company is called Medical Massage of the Rockies, and they basically take care of all the billing, and all I have to do is take care of the client. They take care of the back end, I take care of the actual treatment.
And they pay you.
And they pay me a percentage of that claim. And so,
cool.
Yeah, it's pretty cool. It's a pretty cool gig, and it's rewarding. Not all my clients come in with issues, usually. It's just like, I just want a relaxation massage and just overall general maintenance. And that's fine. Maintenance massages are great. I applaud that. It's like, that's like the same thing as almost like preventative medicine, right?
Yes.
It's like you're preventing any current issues from getting worse.
Yes. Mostly that's what I get from you.
Right.
Mostly.
Yeah.
Although the other day we were working on my wrist, and I never followed up with you, by the way, but now is as good a time as any. The next day, one session of wrist stuff, the next day it was like 80 to 90% better. Just like that.
That's what
just
I like
with
to
that
hear.
one session. Heavy forearm work, heavy hand work, a little carpal tunnel work, and boom. And the next day is like, for the first maybe 4 hours out of my 6-hour shift, I'm hitting it, and it felt awesome.
That's what I like to hear.
And the following day, I got it adjusted by one of the other chiropractors in my office, and then that bumped it from the 80 to 90%-ish, that bumped it up to 100. So,
nice.
So there's one success story with me. He helped me with my wrist stuff.
That's awesome, and I could give the same to you, Mata. Thank you for helping me with the jaw and the headache that day and the neck pain. It's just you found that spot, and I don't know how you do it. That's another thing we could go into, but like palpation, like what do you feel in the body? Like,
That's a question.
I always, especially when technique class with your students, it's like, how do you describe what you're feeling sometimes? Right? It's like, okay, it feels like tension, but what kind of tension? Is it like steel cable tension, or is it like viscous tension? And you know what I mean? There's like different types.
Yes.
And they come in different forms.
Yes.
And it's not as hard as bone, so I know it's not bone, but it's not. And so, yeah, it's like things like that. It's like, how do you describe what's under the skin?
I mean, sometimes deep fascia on top of a muscle can feel like a bone.
It can.
Sometimes it can be that tense.
It can,
that it literally sometimes feels like a bone. And that's why I think knowing anatomy really well is super helpful.
Yeah.
Especially with the dissection process, because you get original textures. Even if those textures have been altered by embalming fluid or by refrigeration, and by the death process, still the differences between one texture to the next texture, that difference is still a difference.
Yes.
So getting it texturally into your being as a learner, as a student, getting that texture in your anatomy education is so important in my mind, So, it's a really big one. And another thing that has really been striking me lately is how much the life force seems to be part of the equation. And I know it's like when I say that, it's like, well, yeah, duh. But still, though, I have to say it anyway because I've just really been struck by it. That I'm sort of like trying to. How do I say? I'm trying to like explore that more of like how much it is that I'm interacting that's physical, and how much of what I'm interacting with is life force that is animating that physicality.
Oh yeah.
And I don't know. That's just it's worth thinking about more than what I have thought about it already. Because I've thought about it a bunch. We learn about it in school, all the life force and free the life force and this kind of thing. But it's like, I don't know, it's hitting me different the last couple of weeks.
Dive into that a little more because I'm curious on what you're talking about, Mata. Are you talking about like the meridians, like a meridian gets blocked and life force energy doesn't go through that meridian properly? Or is this like they don't have full movement and that the lack of movement means less energy? But what's kind of like your thought process?
I more mean like...
Yeah.
I more mean like let's say I put my thumb into one of the erector spinae muscles, one of the muscles along the spine. I put my thumb into one of those, into some of that muscle tissue, and then I feel the person like You know, that reaction is not a gross thing. It's not a physical thing.
Right.
That's a thing of life.
Yeah.
That's a thing of that person's life force expressing through their body.
Oh, that's
I
love that perspective.
Yeah, or like the opposite. Like I'll put my thumb into some spinal muscles, and then it feels like a tough texture, and then they accept it and they sink into it, and then it goes soft.
Yes.
That is a function of life force. That is the thing that we interact with, and it's expressing through this physical form. But the physical form is the wake along the boat. It's not the engine.
Right.
The life force is the engine.
Yes.
You know what I mean?
Yes.
And so I've really kind of been like trying to explore that more within my own practice, like kind of like reflecting on that and how important of a thing that is, because whenever, and especially when I have the contrast of the cadaver form versus a living person.
Yes.
The contrast of life force absent, life force present is such an insane contrast. It's so different, And so whenever it's there, you interact with it. I don't know. I mean, you can interact with it without the life force too, and that's super valuable, But I don't know. That's really been striking me lately.
I'm glad I think that's a really interesting topic, because I'm sure all body workers can relate to that. You find that one spot, the body starts to animate, and there's like a couple different types of animations that I've noticed. And I'll see if this resonates with you at all. The first one, and this is the one I think you're mentioning, is I find that spot, and it could be like I'm just doing a gentle craniosacral hold, and the body starts to animate because I've released whatever fascial restriction, whatever it might be. Or I find a trigger point when I'm doing my deep tissue, my fascial work, and I put my finger in it and the body starts to animate. I'm kind of talking about the same thing with this. And what it seems like to me is like there's like, if the fascia is restricted, that's where less life force energy can penetrate that area. And in craniosacral, they'll mention things like, for example, an energy cyst. And so an energy cyst is, I had something chaotic happen to my body. Someone punched me, I fell down and hit my head, whatever it might be, whatever traumatic incident, that kinetic energy going through your body has to either dissipate that energy or it gets stored in your body. And does it have an emotional component to it? Well, that's a whole other thing, right? But the body is just trying to mitigate the damage from the trauma that was done at that point in time. And where that energy gets stored, first of all, it's energy. So if I put my intention and my touch into that area, the body's like, oh yeah, let's release that, I'm ready. And of course, there's some times where I will feel something and the body's not ready to release it yet. And that's like an inner physician thing, right? The craniosacral people talk about the inner wisdom, the inner physician. It knows your treatment plan. It knows when it's time to release something and when it's not. But we're going to say for that, in this case, it's ready to release. It's energy. So when I'm putting my intention there, that is energy dissipating. And sometimes that energy dissipating animates the body and all these different movements happen. And that's the way my current model of interpretation is for that type of release is energy, chaotic energy that was put, what they call an energy cyst, into one area, and that energy has to be released. And sometimes that energy will animate the body as it's releasing.
That's fascinating.
I know, right?
That's fascinating.
That's one model of interpretation.
You're learning this from Upledger.
Yes, this is Upledger.
This is Upledger.
And this is actually in the craniosacral 2 class model. It must have been a while.
Incredible.
I know, right?
No, incredible. There's, I'm sure you'll be happy to hear that there is a chiropractor. Her name was Sue Brown, the late and great, amazing Sue Brown. So I have to back up one step further before I go into Sue. Chiropractors have been very interested to know why it is that chiropractic works, ever since we first kind of started doing chiropractic work. We've been very curious to know how does this work? What's the deal?
Yeah.
And so Sue Brown came up with what she called the potential energy theory. I'm pretty sure I have that term right, potential energy theory. And what she says is pretty much exactly what you just described.
Oh.
You have a stored thing and it locks in, and that she called potential energy.
Yeah.
And then if it stays stuck in there, then it's going to interfere with the flow of life force.
Yes.
And if you release that or integrate that into your being, then all of a sudden the life force can flow more smoothly and freely through the whole thing.
Yes.
And so yet again, we're hearing the same concept from two completely different fields. I don't know, maybe Sue did know Upledger. I wouldn't be surprised if she knew Upledger very well.
Sure.
At least his work. They were contemporaries, time-wise. So, but in any case, it's just, I'm again struck by how between disciplines we can be finding the same concepts. So, hooray.
I love bridging that gap with you, Lana. That's amazing, dude.
Yes.
So, in your current understanding, how do you like to, if someone asks, what does chiropractic do?
Oh, God.
Let's get into it, Madhav. What do you tell them? What do you think you're going to tell the layman person who doesn't understand anatomy, and what do you think's actually happening?
Yeah. To be honest, man, I don't really know.
It's an honest answer.
I don't really know how. I don't really know. I like Sue's idea, this potential energy theory that we just kind of went through. Like, I find that to be very elegant.
Yeah.
I find that to be very nice. I like that. It's a little bit esoteric, It's like you can't really nail that down. I don't know. Maybe we someday can nail it down scientifically. But I don't know. So far, I don't know how we would ever be able to nail that down scientifically. But that doesn't, whatever. That doesn't mean it's invalid. But I like that story. I think that's a good one. Another story that I'm very fond of is something that Dr. Heidi Havik and her team have been working on for a long time, and that's the neuroplastic / I'll call it like a proprioceptive reset model. I don't think that's what she calls it, but I'm going to call it that right now.
Yeah.
Proprioceptive reset. So, we have an internal, our brains and our persons, our selves, we have an internal map of where our body is. This is for the people listening because I know you know what proprioception is. But, I have my eyes closed and I can do like this and I can feel, without even looking at it, I can feel that I'm holding my hand up off to the right of my face with 2 fingers up, and I don't even have to look at it to know that that's the case, right? I have an internal map of myself, and I can feel my body moving through space. So sometimes that internal map can get not very accurate. Sometimes it can get glitchy. We can have glitches within that proprioceptive map.
Yeah.
And so body work, this is something that Dr. Havik has been working on. She says that with a chiropractic adjustment, we can get a reset into that proprioceptive map. Yeah. So, like, let's say that there's some kind of we sense that there's some kind of tension pattern. I sense that I have low back pain, or I sense that I have hip pain, and yet if you take an image of that tissue, the image will say A-OK. How often have you had clients that come in and they say, look, the MRI says that I'm perfect, but I have this incredible levels of pain. What the hell? Yeah. The CT scan says that there's no tissue damage, but I feel like I'm in pain. And then the opposite is also true. We have, there's been, this is well documented these days, that there's huge tissue damage and the people feel that they're fine.
Yep.
That also is true.
Yep.
There's plenty of people who have blown out knee ligaments and they have no idea that they have blown out knee ligaments. They feel like they're fine. They walk around, they run, they exercise, like they feel like they're fine. And yet if you take a picture of it, an internal picture with an MRI or a CT or something like this, it's shredded to bits. So what I mean to say with all of that is that tissue damage and pain is not very well correlated. It's actually very poorly correlated, right? So if we have an internal sense that there is some kind of problem going on, and yet the tissue is fine, well, let's do some body work, and then you can reset that neurology. You can reset that proprioceptive map. So I also like that story a lot. I find that story to be very elegant also. So the problem that I keep running into is that I feel like sometimes those stories are partial. Sometimes those two stories that we were just talking about, sometimes they don't necessarily apply to Joe, who's laying on my table right now. I don't know exactly what's going on with Joe. I don't know exactly what's going on with Jane. So how do I know if that's applying to them or not? How do I know if something else is going on? What if it's that Joe doesn't have a relationship with his mother, and that makes him sad, and that sadness, what if that's what's going on, and that sadness is manifesting as whatever, foot pain or some stupid thing. I don't know.
Yeah.
There's so many, and this is the problem that I run into is that there's so many options of what could be causing what and how my work could be working that I don't know how to. I don't have a blanket answer like this is why what I do works. Another one that I really like, and I have this picture. Maybe I can edit it into the video in post production. But I have this painting that I love so much. And the painting is of a person at the head of a table. There's another person lying down on the table, and a person kind of like holding the head like this. A body worker, right? And then in the background, there's an angel. And this angel is kind of like wrapping the whole scene like this. And talk about esoterics, what if that's what's happening? Yeah. What if it has nothing to do with me? And what if it's just that I am like a medium through which some kind of higher power is doing the work? What if that's what's happening? What if all of the above is happening? I don't know what's happening. So it's an extremely difficult question for me to answer, and maybe it'll take me a lifetime to never figure it out anyway. But it's like what you just asked me is maybe one of the biggest questions that I have in my own mind. What is it? What am I doing when I put my hands on somebody? I have no fucking clue.
Preach to the choir, man.
No
what
idea.
The heck am I doing? It's working. It's it's working, but why is it working?
Exactly.
Yeah,
it works. The work works.
The
story about why the work works is so ethereal. It's so it slips right through my fingers like water. I just have no idea. And the people who really think oh no, I'm releasing the such and such ligament and I'm doing the such and such work and I'm doing this and now it just released and that's why you feel better. Well, maybe that's true. Maybe there is some truth in that. And yet I have a hard time believing it sometimes.
Yeah.
I have a hard time. But maybe it's true. Maybe in this particular instance, maybe it's 80% true. I don't know.
Yeah.
So
I would like to say what I have. This is a good point to talk about it because I liked when you even brought up hey, am I just a channel or a medium through which a higher divine power can help me assist or facilitate healing in this person? And I keep thinking about that a lot. So I have esoteric training such as Reiki, and I do more things like that. And even, and this is what always gets me. Even modalities like craniosacral, they have a technique called direction of energy. And you're and I even so they have an Upledger alumni Facebook group. And when you graduate from one of their classes or take one of their classes, you can enter this group. And I simply posed a question in the Facebook group. I was direction of energy. So what kind of energy are we talking about here? Could I offer Reiki energy and offer Reiki energy in my direction of energy technique? Would that help it facilitate more? Or am I just, as long as I'm on a high frequency baseline level, it can be any of those esoteric frequencies. It could be Archangel Michael. It could just be pure gold divine light. It could be God himself. It's how do you know? You don't always know what it is that you're chanting. So I think that's just that's one of the really things that always fascinates my left brain is what is it that we're actually tapping into when we offer this energy to our clients. So Joe Dispenza and even some other people, they'll bring up the point, well, where you place your attention is where you place your energy, right? So I've noticed this in body work. I will do like a cranial vault hold. It's not even necessarily a cranial vault hold. We'll just say like a dural tube traction. So I'm grabbing the base of the occiput or cupping it with my hands, and then I'm just doing a gentle traction backwards. And it's like elongating their neck, right? So the idea is that the dural tube, which is that membranous, the meninges around the brain and spinal cord, I'm kind of lengthening that tube and allowing those restrictions to kind of unwind, doing that traction. And so I notice that the body will always give way to my intention. If I place my attention where I want to place it, the energy will follow and the body responds. If I'm in the middle of doing a dural tube traction and, what's for lunch today? What did my partner say about me the other day? I have to work tomorrow. I have to, and you get all distracted, the magic stops. And I found that so interesting. And I think it's under talked about. It's not something we talk about in our massage course, for example. It's like there is something sacred about body work in general, right? It's like this person is taking their time, paying you their time to be here for your attention. That's pretty much what they're paying you for. And your energy, it's an exchange of energy, right? And so it's like that's why meditating is one of like the important practices for me, because I want to be able to give them 100% focus when they're on my table. I want to be able to refine my attention to their body and be 100% present with them. And I think that's like one of the biggest things we could do as body workers. I always tell my students, like, the moment the treatment starts isn't necessarily on the table. It's when they walk in the door and they feel your presence and they feel your attention is on them and they feel your energy and your aura, your field, they pick up on that, right? Just your healing presence, just your presence alone and your attention is healing.
Yeah. Dispenza would even say as they're driving to your clinic.
Yes, even as they're driving.
Dispenza would say as they're driving to your clinic, that's when the session starts.
That's right.
Yep.
That's right.
Yep.
Prime example. So it's like, I think that's a huge component of it. And, you can be really intentional with it, where it's like, I want to channel Archangel Michael because I think he can help me here. That's usually right brain or something within your inner guidance is saying, maybe I should tap into this particular frequency or this particular being. But, I've noticed that I kind of leave that open for interpretation, for whatever inner wisdom is speaking to do that. I don't have to put so much focus on that. My left brain was constantly getting in the way of, which one do I do? Do I do this archangel? Do I do that archangel? Do I channel Dr. Upledger? And that also kind of works too. If you channel like one of the like serious mentors or founders of that practice, they'll come in.
Yep.
I love that, and I think it's great. But you don't even have to be so logical unless you think it's necessary. It's just like, as long as I'm up here at a high baseline frequency, whatever that looks like for you, and I put my intention on them, that's all they need. A nice neutral space to hold for healing. So, yeah.
I had more questions, but that was so beautiful. I think that might be the perfect place to end, actually. I think that might be the perfect place to end.
Beautiful.
There's so many more things that we could talk about.
So many.
Maybe we'll do that.
I hope there's a part two. There's so much we could cover.
Maybe we do a part two. But that was just so lovely the way you just put that. Maybe we call it. Yeah. Thank you so much for talking with me today, dude.
Yeah, man.
And we'll schedule a part two at some point.
All right.
And thank you for everything that you do. Thank you for sharing with us. Thank you for sharing with me. I learned a bunch today. And much appreciation.
Happy to be here, man. Thank you for having me. It's a pleasure.